When it comes to your health, you don't want an opinion. You want an expert verdict. We've distilled decades of clinical experience from top urologists and endocrinologists into one video. Forget the online forums. Today, we are ranking all three major TRT methods, injections, gels, and pellets, from worst to best. The criteria? Not hype, but what doctors value most. Hormone stability, long-term safety, and patient success. The number one pick might surprise you. To choose the right method, you must understand the 4 non-negotiable pillars doctors use to evaluate TRT. The first pillar is hormone stability. Knockade. This is perhaps the most important factor. Are your testosterone levels steady throughout the day and week? Or do they spike and crash? Stability directly links to how you feel, your mood, your energy consistency, and your overall vitality. Roller coaster levels mean roller coaster results. The second pillar is safety and bioavailability. NIME. How efficiently does the testosterone get absorbed? And what are the long-term risks associated with the delivery mechanism itself? You want maximum benefit with minimal worry. The third pillar is cost and convenience. Cost and NART. This covers the annual financial outlay and the practical effort required, whether that's a quick daily routine or a significant, infrequent procedure. Finally, the fourth pillar is lifestyle integration. Does the method enhance your life, or does it force you to change your habits to accommodate the treatment? These 4 pillars are the foundation of our ranking. Before we unveil the method landing at the bottom of the clinical ranking, subscribe to Gentleman's Vitality. We deliver expert-backed strategies every week to help men over 60 regain their vigor and master their health. Now, let's start the countdown. The method that often lands at the bottom of a clinician's list and takes our bronze medal is topical gels and creams. Talk. Many men start with gels because they seem easy. No needles, no doctor visits every few weeks. You just rub it on your skin once a day. This non-invasive nature is their biggest advantage and why they are so popular. However, the convenience comes with 2 significant drawbacks that dramatically affect the first 2 pillars: stability and safety. First, the absorption rate is highly inconsistent. A high percentage of men simply do not absorb the testosterone effectively through their skin. Factors like showering time, excessive sweating, or even the type of moisturizer you use can affect how much hormone actually enters your bloodstream. This leads to inconsistent T levels and frustrating results. You might feel great one day and sluggish the next, despite using the same dose. This inconsistency fails the test of hormone stability. But the most serious clinical concern is transference risk. Gels create a real, quantifiable risk of transferring the medication to others through skin-to-skin contact, even hours after application. This risk is unacceptable if you live with a partner, children, or grandchildren. The necessary protocol, waiting for the gel to fully dry, covering the area, and strict hand washing, turns the supposed convenience into a daily anxiety. For many men over 60, who often have daily contact with family members, this risk alone is enough to push gels into the lowest ranked category. The data shows too many variables and too many safety compromises for gels to be the preferred choice for long-term optimization. We must now turn our attention to the more permanent options. Which one secures the silver? Moving up the scale, the silver medal, our second-ranked method, goes to testosterone pellets, often known by brand names like Testapel. This method excels in the category of lifestyle integration. Pellets are tiny, custom compounded doses of solid testosterone. They are implanted under the skin, usually in the hip or buttocks, during a simple, minor office procedure. The major selling point is this: once they are inserted, you are done for 3 to 6 months. This, set it and forget it, convenience is extremely appealing, especially for busy men or those who travel frequently. It eliminates the daily routine of gels or the weekly schedule of injections. Furthermore, pellets offer excellent hormone stability. Because the testosterone is slowly released into the bloodstream over a long period, they avoid the steep peaks and sudden troughs associated with weekly injections. This slow release is ideal for maintaining consistent mood and energy. So why don't pellets rank number 1? The primary concerns are rooted in the pillars of cost and safety. Firstly, the procedure must be performed by a trained professional. This is a recurring minor surgery, typically required 2 to 4 times a year. While the procedure itself is quick, it involves anesthesia, a small incision, and a recovery period. This introduces minor risks of infection, bruising, or pellet extrusion. Secondly, and perhaps most critically, the dose is inflexible once the pellets are placed. If you discover the dose is slightly too high or too low, or if your body's needs change mid-cycle, you cannot easily adjust. You must wait for the current batch to be fully absorbed before the doctor can correct the dosage. This lack of control and the high recurring surgical cost keep pellets from achieving the top clinical ranking. For men who value ultimate control and flexibility, the silver medal method is simply too rigid. That brings us to the gold standard, the number 1 clinical choice, and the method preferred by the majority of endocrinologists for long-term health optimization: testosterone injections. Now, if you immediately thought of large needles and uncomfortable visits to the doctor, you need to update your perspective. Modern injection methods have made this process much simpler, more comfortable, and highly superior in terms of the 4 critical pillars. Injections, particularly using testosterone cypionate or enanthate, provide the best control over the hormone stability profile. While the older, less frequent intramuscular injections did cause high peaks and low troughs, the dreaded testosterone roller coaster, modern protocols have solved this. By switching to lower dose, more frequent subcutaneous injections, often done twice weekly, doctors can maintain remarkably stable testosterone levels. This twice-weekly schedule smooths out the peaks, leading to consistently better energy, mood, and cognitive function throughout the entire week. Stability is excellent. The financial pillar also strongly favors injections. They are, by far, the most cost-effective method available. The cost of the medication itself and the necessary supplies is low, especially when compared to the high monthly prices of gels or the procedural costs of pellets. This makes TRT sustainable over decades, which is critical since TRT is usually a lifelong commitment. Finally, the greatest clinical advantage is dose flexibility. Dose boast. If blood work shows your testosterone is too high or too low, your doctor can immediately adjust the dose for your next injection. This instant, precise control means the therapy is perfectly tailored to your body's changing needs, ensuring long-term safety and success. While injections do require some self-administration, the high control and superior results make them the undisputed clinical gold standard. But are they right for you? We must now examine the nuances of administration and address the most common objection. The most significant hesitation men have about injections is the needle itself. This is often based on outdated experiences. Modern protocols favor subcutaneous injections, or sub-Q, which are done using tiny insulin needles. These needles are extremely short and thin, making the process nearly painless and very simple to administer at home. It's a vast difference from the deep intramuscular shots of the past. Subcutaneous injections also expand your administration options. They allow men with low body fat or mobility issues to easily manage their therapy, injecting into areas like the stomach fat or thigh tissue. It simplifies the routine dramatically, minimizing discomfort and maximizing compliance. The overall lifestyle integration of injections is manageable once the initial hurdle is cleared. Injecting twice a week takes less than 5 minutes of actual time. This small time commitment buys you the highest degree of dose flexibility and hormone stability. Think of it as a small, focused investment of time that yields the biggest, most consistent results in your energy and vitality. However, the 3 delivery systems we have ranked gels, pellets, and injections all serve different men best. The ranking reflects clinical efficacy and safety profiles, but your personal situation must always be the deciding factor. The optimal choice is the one that you will stick with reliably and safely for the next 20 years. So how do you decide which category you fall into? We need to look at 3 common profiles of men over 60 and match them to the TRT method that makes the most sense. Let's examine the first profile, Nada, the traveler, or the minimalist. This man wants the absolute least amount of fuss and avoids daily routines. He travels extensively or simply dislikes having medications visible or requiring daily attention. For this man, the highest-ranked option might not be the right practical choice. The pellet method, despite its rigidity in dosing, offers the ultimate benefit of months-long freedom. If his initial dosage is dialed in perfectly, the infrequent procedure is a massive win for lifestyle integration. The trade-off is the higher cost and the inability to quickly adjust the dose. For the man who prioritizes freedom from routine above all else, pellets are often the better fit. Next, consider the social man. This is the man deeply concerned about transference. He has frequent, close contact with his partner, family, or grandchildren. His priority is the safety of those around him. For this man, gels are definitively ruled out. The risk of accidental transference is simply too high to manage reliably every day. His choice narrows down quickly to either injections or pellets. Since injections are contained entirely within the body and require no skin-to-skin exposure, they are the safer, more manageable choice for the man prioritizing social safety. Finally, we have Asterix the Maximizer. Asterix, this man prioritizes precision, control, and long-term financial sustainability. He is comfortable with a simple, sterile procedure and wants the best clinical results possible. The Maximizer wants to track his hormone levels and work closely with his physician to make tiny, targeted adjustments. The best choice for the Maximizer is clearly the injection method. Its low cost makes it sustainable, and its inherent flexibility allows for the precise, frequent adjustments needed to optimize those stability benchmarks. Choosing the best method is really about honestly evaluating which of these profiles aligns most closely with your life. Now let's look at the financial reality. While our ranking focused on clinical outcome, the cost can be the deciding factor for long-term adherence. The annual cost difference between the three methods is significant. Injections are the financial winner by a huge margin. The testosterone compound itself is often inexpensive, and the needed supplies are minimal. If you are paying out of pocket, injections can cost hundreds of dollars less per month than the other options. Over a decade of therapy, this saving can amount to tens of thousands of dollars. Gels sit in the middle. They require daily application, and the cost per dose is often very high. While insurance coverage varies widely, the overall cost of the product can make it prohibitive for men on fixed incomes. Pellets are the most expensive. Because they involve a recurring medical procedure, the implantation, the costs associated with the doctor's time, the facility fee, and the pellets themselves quickly add up. If your insurance coverage for procedures is poor, pellets can become a massive, unsustainable expense. It's crucial to understand your insurance benefits for both pharmaceuticals and procedures before committing. Never compromise your financial peace for a perceived increase in convenience. Before we conclude, let's talk about a few crucial nuances specific to men over 60. Many men in this demographic may have pre-existing cardiovascular conditions or prostate concerns. When starting TRT, the ability to quickly and safely adjust the dose is a non-negotiable safety feature. This is another powerful reason why the inflexibility of pellets is a serious drawback. If a physician notices any adverse trends in your blood pressure or red blood cell count, they need the ability to quickly decrease your dose. Injections offer this instantaneous control. Pellets do not. This responsiveness makes injections inherently safer for the senior demographic managing complex health profiles. For men who are new to TRT, the ability to reverse course or adjust quickly is paramount. Think of starting TRT as a careful titration process. You and your doctor are working together to find the perfect level that maximizes benefit without introducing side effects. This optimization period often lasts several months. During this time, the ability to make small, precise changes based on weekly blood work is invaluable. The daily application required for gels allows for immediate cessation if an issue arises, which is a safety advantage. However, the inconsistent absorption makes finding that perfect gels dose a difficult target to hit. Pellets, on the other hand, eliminate the chance to fine-tune the dosage during the crucial initial phase, potentially extending the time it takes to achieve optimal health. This is why many experienced physicians prefer to start a new patient on injections. They get the patient optimized using the precision of the injection method, and then once they might consider switching to a more infrequent option like pellets, if lifestyle demands it, and if they are confident in the patient's ideal maintenance dose. So while injections earned the gold medal for clinical superiority, remember the true takeaway: the optimal method depends on your life and your specific needs. If you are extremely needle-averse and value convenience above cost, pellets are a viable option once optimization is achieved. If you are comfortable with self-administration, prioritizing maximum stability, flexibility, and cost-effectiveness, injections are the clear winner. If you are using gels, you must enforce stringent safety protocols and monitor your absorption levels carefully. No matter which method you choose, the goal is the same: stable, healthy testosterone levels that restore your vitality. Your job is to go into your next doctor's appointment armed with this knowledge. Do not simply ask, "Do I need TRT?" Ask, "Based on my lifestyle and my safety profile, which method is best for achieving stable, long-term optimization?" To help guide that conversation, here are 3 essential questions you must bring to your physician, regardless of which method you are leaning toward. First, ask specifically about the hormone stability graph for the recommended method. Request a visual understanding of what your testosterone peaks and troughs will look like. For injections, you should be aiming for a protocol that avoids significant drops right before the next dose. If they suggest a 10-day or 14-day injection cycle, ask them to explain how they will mitigate the inevitable late-cycle slump in T levels. Second, inquire about *until backup and reversibility, *until mend. If you are considering pellets, ask your doctor what the plan is if the dose is too high. How quickly can they safely lower your circulating testosterone? Understanding the limitations of reversibility is crucial for your long-term safety. Third, discuss *NOPS monitoring frequency. *NOPS. While TRT is a lifelong therapy, the early stages require closer monitoring. For men over 60, regular blood work is vital. Ask how often they will be testing your sensitive estradiol, hematocrit, and prostate markers in the first year. The method you choose should align with a rigorous, proactive monitoring schedule. This deep dive into the clinical ranking of TRT methods, injections, gels, and pellets, has hopefully clarified the complex factors involved. We broke down why injections are the clinical gold standard due to precision and cost. We identified pellets as the convenience winner despite the high cost and rigidity. And we outlined why gels, despite their ease of use, pose unique safety and absorption challenges. Taking control of your health means choosing the method that supports your life, not complicates it. Remember that every method requires commitment. There is no passive TRT. The success of injections relies on strict adherence to a schedule. The success of gels relies on rigorous safety protocols. The success of pellets relies on frequent procedural visits and accepting the lack of mid-cycle adjustment. You are the CEO of your own health, and you must choose a delivery system that aligns with your leadership style. For men who embrace organization and consistency, injections offer the most control and the best results for the lowest financial cost. It's an efficient system for the man who is serious about optimizing his health data. It's a powerful way to reclaim your vitality without compromising your financial future. If you found this in-depth, evidence-based breakdown valuable, please let us know by liking this video. That simple click helps us reach more men who are looking for serious, actionable health information, cutting through the noise and focusing on proven science. Do not let outdated fears about needles dictate your health choices. Focus on the outcome: stable hormones, improved energy, and a better quality of life. The method is just the delivery vehicle for that crucial result. Choose wisely, choose informed, and commit to the process. Your stronger, healthier, and more vibrant future starts now. One final important consideration for the senior man is dealing with potential side effects. The ability to manage and quickly reverse an adverse reaction is a key differentiator. If, for example, your red blood cell count, known as hematocrit, begins to climb too high, a common side effect of TRT, your doctor will need to reduce the dose. With injections, this reduction is immediate. Your next scheduled dose is simply lower, and the situation is managed quickly and effectively. With pellets, a high hematocrit level requires waiting several weeks or even months for the release to slow, which can force your doctor to take more invasive measures, like therapeutic phlebotomy, to safely manage your blood viscosity. This simple comparison highlights why flexibility is not just a convenience factor, it is a critical safety valve. For men managing pre-existing conditions, that safety valve is non-negotiable. Choosing the gold standard method, injections, gives you and your doctor the ultimate tool for precision management. It provides the highest degree of safety because it is the most responsive method. It ensures that when your body talks through blood work, your therapy can listen and adjust instantly. This level of responsiveness is particularly valued by the most experienced practitioners who manage complex cases in older men. They understand that quick adaptation is the key to maintaining long-term health and minimizing risk. Let's briefly revisit the issue of lifestyle integration, specifically regarding travel. While pellets offer the most effortless travel solution, injections are far simpler than many people assume. Carrying small insulin needles and testosterone vials is legal and straightforward. Many clinics provide necessary documentation for seamless travel, especially within the United States. Unlike gels, which require meticulous containment to prevent accidental contamination in shared spaces, injections are self-contained. You simply administer the dose and dispose of the sharps safely. There is no risk to others. No concern about product rubbing off on airline seats or potential mess in a hotel room. This makes travel with the injection method surprisingly manageable and worry-free. The injection method offers a blend of superior clinical results and practical manageability that is often overlooked due to the initial fear of the needle. Remember that the tiny needles used for subcutaneous injections require minimal training and quickly become a routine part of your week, much like taking any other daily supplement. Do not let minor psychological barriers block you from accessing the most clinically sound and cost-effective method of long-term health optimization. The benefits of consistent, stable T levels far outweigh the few seconds of self-administration required. That commitment is a powerful investment in your long-term vitality.